Hello everyone, welcome to the Dubai's World channel. Here we are going to discuss about the clinical features and the types of the polio disease. Actually, the clinical features of a polio viruses infection may occur in two forms. First is inapparent or asymptomatic. Second is the apparent and the symptomatic. Actually, the inapparent and asymptomatic is this much 90 to 95% of cases is the seen, but here this apparent or the symptomatic mostly seen in the 5 to 10% of cases. Inapparent asymptomatic is in this the viruses stay in intestinal tract and does not track the nerves. Here the viruses is shed in stool. So the infected individual can infect others. They are having ability to infect others. But in case of apparent and the symptomatic, here this shows abortive polio, paralytic poliomyelitis, and third one is a non-paralytic aseptic meningitis. Non-paralytic aseptic meningitis. And the last one is a polio encepalitis. Now we are going to discuss one by one. This abortive polio, in this type of polio, in the patient, mostly 4 to 8% of infection in a patient we can see 4 to 8% population we can see this type of infection, but this does not lead to a paralysis. In that we can see the minor illness, and the symptoms we can see in the first one is low grade fever, malaise, and the third one sore throat. Actually, this type of polio, abortive polio, this may recover in a 1 week if proper treatment is given. This may recover in a 1 week or mostly in a 1 week or more than 1 week. But this is not a paralysis. Here we will not see the paralysis. Now we will see the paralytic poliomyelitis. In this 0.5 to 1% of infection we can see in this type of patient, and this occur in a 2 phase. The minor one is same as a abortive polio, and the major is having a muscle pain, spasm, return of a fever. Every time the fever will go and come, but this will follow the rapid onset of a flaccid paralysis. This will having a flaccid paralysis. Now we'll see the non-paralytic aseptic meningitis. This will occur in 1 to 2% of a polio infection. Here we'll see the symptoms like a headache, vomiting, pain, stiffness, and stiffness of a neck, back and legs. And this one may recover after 2 to 10 days. While getting the symptoms, this will recover in a 2 to 10 days. And the last one is a polio encephalitis. It's occur in a rare case, and it causes inflammation in a gray matter. Inflammation in a gray matter. And the symptoms we can see in this: agitation, confusion, stupor, coma and irritation. So much of. That's it for clinical features. And now we'll go for a diagnostic study. In this, how we can come to know this viruses is there. So we'll do the diagnostic studies, and here first we'll do the viruses culture. Virus culture. In this, the polio is confirmed by isolation of virus by culture. In that will in this culturing of this viruses from a stool or a throat swab, or also we can say the CSF, cerebrospinal fluid, but in a rare case. In an infected person, the virus is mostly likely to culture in a stool culture. Mostly we'll use this stool culture to see the to grow this viruses. Next we'll do the serological test. Another way we can do, another test is there. From there we can diagnose this viruses is serological test. It's here acute and convalescent serum sample may be tested for a rise in AB titer. For a rise in AB titer. AB is antibody titer, AB to antibody to, and antibody to polio viruses. But the report can be difficult to interpret, as in many cases there is a rise in a many like titer may occur prior to the paralysis or may after to this paralysis. So this may show some difficulties. So next is one more test is there to do to diagnose this is a cerebrospinal fluid test. Cerebrospinal fluid test. In this, infections with the polio virus may cause an increase of number of a WBC and a mildly elevated protein level in a CSF. So in this we can there is a collection of a cerebrospinal fluid to see the increase of number of a WBC or a mildly elevated protein level in a CSF. I'll write it off. Infection with the polio virus may cause an increased number of WBC and a mildly elevated protein level. In a CSF. This was the diagnostic study. Now we'll see the treatment. Now, how we can do the how we can give a proper treatment to that patient who is having this type of symptoms, which may later become polio or a poliomyelitis. So we'll give this type of a treatment to that person. First, in the treatment of a polio virus, the major goal is to control the symptoms while the infection run its course, as there are no specific treatment for this viral infection. But the treatment may include like antibiotic for urinary tract infection. As the symptoms increase, at the time we can give this type of antibiotics, because there may be a urinary tract infection, so we can give the antibiotic for this. And the second, we can give the moist heat to reduce the pain. As I say, there will be stiffness in the neck, legs, muscles, so at the time moist heat to reduce pain and spasm. And third, we can also give this painkiller to reduce headache, and the same reduce pain, muscle pain and the spasm. And third, we can give a physical therapy. That is very important. Physical therapy or a orthopedic surgery. Therapy or a orthopedic surgery. This two having one goal in a treatment, to recover the muscle strength and the function. Now we'll see the prevention of polio disease. Last, we'll see the prevention. The best preventive measure for a poliomyelitis is ensuring the hygiene. First, we have to ensure about the hygiene. And we have to encourage that person, individual or society for this food, good sanitation processes. But the first thing we have to concentrate, that polio prevention begin with the polio vaccination. Polio prevention begin with polio vaccination. Actually, the polio vaccine has been developed against all three subtypes. As I before in the intro part I said, there are three subtypes: PV1, PV2 and PV3. The polio vaccines are already developed for these three subtypes, and is very effective in the producing protective AB that induce immunity against this polio virus and provide protection from a paralytic polio. There are two types of vaccines. Vaccines are available. First is an inactivated or a killed polio vaccine, that is nothing but a IPV. And the second one is the live attenuated vaccine. vaccines or a oral polio vaccine. Oral polio vaccine. Here, inactivated killed vaccines is the way we are going to use the same organism, and by culturing with a different kind of physical things, like we are going to induce a heat or a formalin to just kill that organism. And the live attenuated organism, as we can say this, we are going to take the organism of the same, and we will manipulate the genetic material in that organism, and then we will induce. So this one is not so for this. Mostly we have to consider it. There are two types of vaccine for a polio: an inactivated killed or a live attenuated or oral polio vaccines. This for a polio disease. I already in before video I already discussed about the intro, then etiology, then pathogenesis. Here today I discussed about clinical features and types, diagnostic studies, and the treatment and prevention. Thank you.